Yeah, welcome, welcome. Thanks very much for joining us on this lunchtime webinar. With that in mind, given that we've got a teeny tiny hour together, we're going to get straight into it because we've got lots to share with you. My name is Sarah Edmonds. I'm co-director of the National Retrofit Hub. And together today with our good friends and collaborators, we've got Hannah and Josh from Centric Lab, and they're waving. And we're going to take you through our journey for our entire measuring outcomes and impact evaluation project. But specifically, we're going to spend the majority of today's call talking about our CHIA workbook that we published yesterday. So it's a community health impact assessment. That's what CHIA stands for, but you're going to find out all about it, and we're going to hold your hand the whole way through. And we're really excited because this is a whole story of taking a seed of a question right the way through a journey to delivering insights, but then also practical tools. So we're excited. Centric Lab have got lots of history in generating practical and useful tools. So we're really grateful to have been working alongside them for this and bringing their world into our retrofit world and vice versa. So I'm going to share my screen and tell you a little bit about what you can expect from today. There will be time for Q&A later on, so don't worry about that. But I'm just going to share my screen and take you through the slides if they want to move. Let's see. There we go. Okay, so this is our agenda for the next hour or so. We're going to take you through the project background and the outputs of the whole project so far. So that will be me yapping away at you for the first 20 minutes or so. And then Hannah's going to take over and explain in a bit more detail about the CHIA workbook. And then we'll have time for about 20 minutes of Q&A. Maybe that will be 15 minutes. We have been working right up to the line on this. So this is our rehearsal for delivering this as well. So be gentle. And then we'll wrap up and talk about next steps. But probably the next steps are going to kind of come to light through the conversation anyway. So yeah, let's just get stuck into it. Let's go straight into it. Um, Yes, so for those of you on the call who don't know us, which I can't imagine there are many, but we're a non-profit. And in fact, we need to change this because now we're a community interest company specifically. And our mission is to enable the local and equitable delivery of retrofit at scale. Um, and who are we? Well, there's five of us in our core team. But we also have our board who stand behind us and keep us focused. We have our collaborators and group chairs, both across our working groups, but also across our cross-cutting themes. We have our advisory panel, who are made up of our strategic partners and sponsors. And then we also have our network, which is where we're going to maybe turn the camera around on you for a second, because we would really like to know, for the purposes of today's conversation, who you are. So if the magic of Zoom works, Ben is going to launch a poll. Ta-da! Could you please click which one? And you can scroll a bit. So if you're not in those top few, there's a few more down there. But if you can reply, let us know who's in the room. It'll help because part of the CHIA workbook, it talks about the archetype of user group, and then it'll help us to sort of emphasize which user group based on who's in the room. So about a third of you have responded so far. And where are we at? We've got lots of industry and supply chain in the room. We've got lots of other. Ooh, would you tell us in the chat who you are if you're saying you're other, if you don't feel seen by our list, and tell us who you are. Um, we've got local authorities, third sector, we've got community groups. But yeah, there's like a whole fifth of you who describe yourselves as other. I'm going to open my chat for a sec to see. Uh, Arm's length public body, combined authority. Okay, fair enough. A chartered residential surveyor, evaluation consultant. Okay. Um, cool. Keep those coming in so we can keep an eye or at least understand who's there. And 43 out of 45 of you responded. Well done. That is excellent. Gold stars all around. But it does look like the majority of those who've responded are classifying themselves in industry and supply chain, and with a sort of a balance on local authority and third sector. So that's great. I'm going to end the poll. Oh, who's the one person who can't access the poll? There's one person. Put it in the chat. Thank you so much, everybody. Okay, we can end the poll. Now I think, oh, 100%. There was an industry person in there. Excellent. Um, that's so great. Let's just quickly share the results, shall we? Um, there we go. We can see. Great. Well, look, thank you very much for letting us know. That will help us and inform us about who showed up today and how to take the direction of the conversation. So, what's our role? Well, the National Retrofit Hub do all these things on screen, but specifically today, this is an example of how we are working to advance research to address critical gaps and to provide independent insights and tools. And so that's what you're getting today. The results of that research and also the introduction to our tool. So the project partners for our measuring outcomes and impact evaluation project, which has been running for over 12 months now, have been Arup, Impact on Urban Health and Trustmark from the beginning. But as the project went on, we were joined by Centric Lab and the Royal Academy of Engineering as partners for different reasons. And I'll talk about when that happened throughout the process. But actually, yeah, maybe Hannah, maybe now's a good time because I'm going to talk for the next 10, 15 minutes. Do you want to just quickly say who Centric Lab is?
Yes, hi everyone. Welcome. I'm Hannah. I'm also joined by Josh. We're both directors at Centric Lab, and Centric Lab builds radical infrastructure for communal healing, and we do that through prototyping ways to use health-based scientific evidence to support justice movements. And we do this primarily through knowledge dissemination, the building of data, tools, and frameworks to support and affirm action on the ground. So we do a lot of work with community groups and supporting them in their use of data. And one of the things that we bring to this is looking at health in its most expansive way and to think about health in a retrofit context much more than just mold and respiratory illnesses, but all of the broad determinants of health, all the things like how safety impacts our health, how a sense of belonging, how the strength of our community and social capital impacts our health. So yeah, we'll come on to that later. Thank you,
Yeah,
Sarah.
we will. And it was wonderful as well working with Centric Lab because, well, we'll get to this in the slides, but it really is important for us all to increase our literacy around what health is and what it isn't. And I love the provocation and the explanations that we've learned from Centric Lab about health being more than just the absence of illness and how our health is ecological and responding, our health systems responding to all of those systems that we interact with every day. But so very, very briefly, back to where this came from. Our working group 5 working group was we published a State of the Nation report 2024 now, which seems like a long time ago, where we were looking at the state of the nation of retrofit delivery. We also have cross-cutting themes to prevent ourselves from building our own silos of knowledge and not making sure that that happens. We have cross-cutting themes so that we can, yes, look at the different big chunks of retrofit, but also understand what are the things that cut across all those themes so that we can make sure we're responding to the challenges of retrofit in a holistic way. But these are the two groups really that this current project on measuring outcomes and impact evaluation came from. So that is the state of the nation. The QR codes should work the whole way through this presentation, fingers crossed. But you can just go to our website and go to our resources page, and all of our resources are in that one place. But our state of the nation was essentially to ask, what does retrofit delivery look like right now? And so that we could understand what are the points in that system that we should be intervening. And one of those challenge points that emerged was around this statement. So we understood that there was significant retrofit activity across the sector, but that our data suggested a real need to identify metrics for both measuring retrofit and quantifying what successful retrofit looks like. So we mean like actually measuring what we are delivering. So of all the investment going into retrofit, what's it actually delivering? And how are we then measuring whether the outcome that was intended has been achieved? And it's really important to do that because there's a lot of time, energy, and money going into retrofit, and we need to be sure that it's doing what it's supposed to be doing. And also, we need to ensure that what it's targeting are the things that matter to people. So, yeah, programs should resonate with the needs of people, and we should measure what matters. Sounds kind of simple, it's a bit more complicated. So we know what matters. Health matters, right? So we've all probably on this call heard the statistic from the BRE report that the NHS is footing a bill of £1.4 billion per year to treat people impacted by poor quality housing. But on the flip side, we know that the social benefits of the transition to net zero are even greater than the financial and carbon benefits, with 79% of the benefits being social or co-benefits, which I think we've all talked about for a long time, the co-benefits of retrofit. But actually, those co-benefits aren't really the co-benefits, they're the core benefits and the core narrative around which we can organize for retrofit. Because we've had a little bit of time spent in this sort of carbon tunnel vision moment where we've been looking at carbon, and yeah, carbon is important. It's so important, but it's not the only part of the picture. And all these other things below that line are vital and important as well. And we need to give due regard to the other components of what the transition to a net zero future would actually look like. So poverty, education, health, and health being the one that we're going big into today. So together with our project partners, in that follow-up to the State of the Nation report, we got to this question: how can broader outcome measurement accelerate retrofit delivery and be designed to drive better policy, funding, and delivery decisions, particularly to maximize co-benefits like health and equity in a fiscally constrained environment? And every time I read that question, I go, that's a big question. It's quite a lot that we're trying to achieve. And so, how do you take on a question of that kind of magnitude? Well, first, we wanted to kind of understand, what could success look like and what does it look like right now? So at the moment, we are focused on carbon and fuel poverty alleviation and the number of measures installed, and those are important, but it isn't the whole picture. So what about health outcomes? What about community wealth? What about happiness? What about resilience? What about those other components? So we took this three horizons model, which some of you might be familiar with, but essentially it's looking at what is happening in business as usual now, and within what's happening, what's damaging and what needs to be hospiced, and what's worth conserving, what do we need to sustain. And in the space of hospicing the bits of business as usual that we don't want to continue, um, what is the innovation that we're seeing coming through, and how do we ensure that whatever innovation is coming through doesn't actually just sort of get us back into a business as usual situation of greenwashing and so forth. So what would a viable future look like? And we have to look at these things simultaneously to understand what parts of the system we want to bring forward and steward into a viable future, and what bits do we want to sort of let go of that aren't serving that future. So we divided the project into 4 work packages. We did a lot of literature review. We did a lot of stakeholder engagement, a lot of meeting and talking to all of you and more people from our network and beyond. And that was why the Royal Academy of Engineering came on board, because in our stakeholder and literature review and our stakeholder engagement, we came across a report that they wrote, which was very, very aligned with the sort of target of what we were looking at. And by joining forces with the Royal Academy of Engineering, we were able to extend our network and learn more from a broader network who were also concerned with similar issues. We also looked at existing frameworks and models of who's looking at broader outcomes measurement already. And then we did some future visioning and policy testing, and we had some great workshops hosted by Arup on that sort of future visioning scenario, as well as some held online. So the outputs included our call out for evidence. So we had this ever growing list of resources and signposting towards who is looking at this broader outcomes measurement. Also energy efficiency metering as well, not just, the broader outcomes, but also what we're supposed to be measuring. Are we doing well on that? And we looked at several innovators. These are just a sample of some of the innovator profiles. This QR code should take us to our measuring outcomes and impact evaluation output page, where we've kind of pulled together all 5 outputs into one page. So you can scan that and you can see all of these outputs. But these are the sort of 2-page innovator profiles that we drew together through engaging with the innovators and asking them, what is it that you're doing? How do we socialize more your innovations to make them tools that can be used right now, and grow and scale that innovation so that people can have access to the tools that will serve us in that viable future scenario and not in our kind of business as usual damaging one? We also do a lot of stakeholder engagement and then share the insights of that stakeholder engagement so that you know what your peers are saying and that you know what the issues are that people are coming up against. This is what practice response looks like. What is happening? How do you feel about these questions that we're asking? And we want to share those as we go. So all of those are in our news section on our website. We also thought it was good to revisit and baseline what we are currently measuring across all the retrofit schemes and also key, like, what are we not measuring? And in there lies the opportunity to explore what could be measured. So there's a baselining document in there. And yeah, I guess before I jump into our final two outputs that are sort of the biggest and most recent ones and the most important ones for us now, as Hannah was talking about, it's really important for us, and we learned this from our engagement with Centric Lab. It's so important for us as an industry to increase our literacy around health. We talk a lot about that stat, right? The 1.4 billion pounds that it costs the NHS, and we talk about the instances of asthma and respiratory conditions and things like that. But it is not the job of the retrofit industry to cure asthma. It is the job of the retrofit industry to ensure that the environments that we have a hand in creating don't worsen the conditions for people. And in actual fact, can they provide spaces of healing, spaces of care, spaces of repair? And so it's the practice of doing those things that we need to be like really mindful of. And so where do we put our energy? We should be putting our energy into understanding what point in the health system is our responsibility to interact with. So it's really enlightening for me to have learned about what the difference is between determinants of health, so the factors in your life and environment that affect your health, but also health indicators, the clues and signs that show the current state of health in a person or a community, the metrics, so what are the numbers used to track and compare health, and then the outcomes. And I think this is really interesting because it's, the result or effects of health factors and care or lack of, and I think that's really important, of a person or community's health. So these things are like really interesting for us to learn to help um, situate ourselves in the health conversation. Okay, I'm nearly done. This one we managed to publish just before the Warm Homes Plan. Not saying anything about who got their report out first, but we did. And this is essentially a culmination of all that research and all that engagement that we did. And the resultant points of this report were essentially we need to broaden how success in retrofit is defined. We need to measure real world outcomes, not just predictions. And we need to support communities to shape and assess the outcomes. And within this document, we've got a bunch of like practice recommendations targeted at different audiences. So for local authorities, policymakers, delivery partners, and communities. And this is just a couple of each of those. There's more in the report. So I'm not going to read these out now because I want to give Hannah enough time. We've also got our policy recommendations and we've categorized those into what type of policy. So finance and governance, data and evidence, knowledge and capacity, and partnerships and civil society. So those are all in that report. And then just yesterday, we published our CHIA workbook. And to quote one of our other partners, it is banging. It's a really, really beautiful report. And it's been the result of hours and hours of deep work collectively, and lots of blood, sweat, and tears went into it. And we want to make sure that we're taking you on what is a really big journey, but that we're doing it in as legible a way as possible. So the point of the CHIA workbook is to understand that a successful national retrofit agenda is understanding how, and here's that key bit around literacy, the determinants of health are embedded into its layers of activity. And the workbook here is to help us find ways to explore mapping health data led by the community in advance of retrofit program delivery. So there's a lot that we're going to talk to you about now, or Hannah is, but essentially the workbook comes in two parts. We've got the theoretic background and the context to health and health justice and the relationship to retrofit in part one. We've also got the practical part, so finding out about who can and should use these assessments, how to use them, and then further resources are signposted to at the end. Yeah, and again, it wouldn't be us if we didn't put in a few policy recommendations. So we put policy after part one and we put practice recommendations after part two. So That's me exactly on the button of 20 past one. I did feel like I galloped through that, however. But I'm going to pass you over to Hannah. There's going to be lots, sorry, before I flick over the screen, there's going to be time at the end for your questions. You can start dropping any questions you have into the chat, and then we can get into the conversation at the end. And we will engage on this beyond today because this is a lot. And I recognize this is a lot, but we will come back to it and we're scheming in the background. So Hannah, over to you. And just tell me when to
Wonderful.
move
Well,
on the slides.
yes, thank you so much. So, as it says on this slide, community health impact assessments offer practical and justice-led frameworks to understanding how retrofit interacts with place, health, and lived experience. We did this because there's a gap, as Sarah would often say, with the policy coming down at the top, which was very flat-bottomed, and the lived experiences on the bottom, and there was no way to account for this nuance of place and health. So a lot of our work is understanding place and understanding how place impacts health. So if you go along into the next slide, Sarah, I think it's about what is an HIA. So before we get into community health impact assessments, for just to keep us all on the same page, it would be helpful to go over what a health impact assessment is. So an HIA is an approach used to systematically judge the potential health effects of a policy, strategy, plan, or program on a population, particularly on vulnerable or disadvantaged groups. So this brings in the public health aspect of it. HIA can help to identify the distribution of those effects of health within the population and generate evidence for proper action to mitigate those health risks, and also to be able to identify and promote health opportunities. But HIAs are predominantly conducted within technocratic or policy spaces and without the input of broad stakeholder groups, such as the community that is most impacted. So as processes, they rely heavily on secondary quantitative data, and that can draw assertions and conclusions that are at times unethical and inaccurate. So this is why doing community health impact assessments are really important, because if we're talking about health inside of people's homes and we're not understanding how those people themselves understand their health, we'll be making various types of assumptions and investments that may in fact have poor outcomes for health. So if you go into the next slide,
And just
this is
apology from me on the slide quality, because I have just taken little snapshots out of our Chia workbook. We wouldn't normally like put this much text up on a slide, and it's a little bit grainy. So that's on me, but you can sit comfortably with the Chia workbook later in your own time. Sorry, just had to say that.
Thank you. Yeah, so a community health impact assessment, on the other hand, creates lived experience data sets that brings the social, commercial, and political determinants of health to life. So if you imagine a group of people together and they're talking about their health, there'll be a way to be categorizing how, when someone's talking about their health at home, we'll be understanding that their housing is having a poor impact on their health, or we could be like, the building management and the way that the management is occurring is creating a level of stress, and this stress is impacting people's health. So it's understanding the very complex, very nuanced things of everyday life that are impacting health. So in doing this, it creates more practical and impactful criteria to measure and evaluate the impacts of a project. So a CHIA, Community Health Impact Assessment, is a tool to baseline your community's health. I saw there was a comment on baselining in the chat earlier. We can come back to talking about that in the Q&A. It's a tool to assess the impact of an anticipated or present change. It's a process that can connect your community to deepen your mutual and collective understanding of your health and place. It's an opportunity to identify and build upon health-giving infrastructures and activities that are already present in the community. And it's an opportunity to surface and spotlight what needs changing. So a CHIO is not just about understanding how something impacts you, but it's a really great baselining activity to understand how health is at play in the community. So I've told you what a health impact assessment is and what a community health impact assessment is. In the middle ground, we have what we've come to understand as a community leaders health impact assessment. So a community health impact assessment, the CHIA is it's a very committed process. It requires many members of the community together to be exploring what these topics mean. And it's not a very rapid response. So we've also created a toolkit for community leaders, which is to use the template of a health impact assessment, but using community data. So that's what the community leaders version is. And the community leaders health impact assessment are a first and incomplete step towards community-centered health impact assessments. So to conduct one with the community-based data ensures a certain degree of accuracy and generates a level of accountability for those that are involved. So that whilst you're using qualitative data from the community, it still falls under a format that has not been designed or imagined by the community. So that's why we see the community health impact assessment as a process as being a much longer, more involved one, but that is ultimately more accurate. So it's important to mention that CHEER as an outcome is a tangible evidence base of community health and the conditions and structures that impact it. And I talk about evidence base because this is a really important thing to be thinking about. Just this morning, we were talking with some campaigners, and they were being told that their lived experience was not matching up with the data, quote unquote data, quote unquote research. And it's important to see that lived experience is a form of data as well. Qualitative lived experience is and can generate data sets that can form the evidence base of decision making that is in fact much more accurate of the people that are in place. And then secondly, I'd like to say that the CHEER as a process, so it's not just an outcome, but it's also a process, is a mechanism of building capacity within a community through identifying nuanced understandings of broad and macro determinants of health on the lived and local level. So if we just go to the next slide, Sarah, we can have a bit of a glance at who can and should use these assessments. So we have like two different workbooks. One is for the community health impact assessment. One is for the community leaders version. The community leaders version is like I said, a light touch approach. But we imagine it will be community groups that are already in the retrofit material and built environment space. Community groups that are in the health and social justice space. We see tenants and residents associations that are not yet organised, but on the brink of change in their neighbourhood, like on the brink of having a retrofit works in place, and those that are recognising community health concerns in their area. We also see it as those that are able to further the use of this tool on the ground. So those are like cheerleaders. They could be in public health departments, in local authority planning departments. It could be in the sector at large, but those that are willing to further the use of this tool, and those that can incorporate this tool into design specifications, so that when a retrofit works is in the planning, then there's space and time and resource allocated to communities to go on this process itself. So we see the self-organizing, the stewarding, and the institutional ones. The institutional partners typically use health impact assessments. We see the institutional partners as an opportunity for them to begin to partner with community organizations to do the community-led community leaders health impact assessment, and we see groups that are self-organizing to go straight to the community health impact assessment. I'm saying all of these very many words, but as you see the workbooks, you'll see which one speaks to which one. Why? Yes, on this slide. And why this is important is because doing this process necessitates a systemic thinking, because it primarily deals with the way in which we understand health risks as a result of structural determinants of health. So a CHEER reveals not only the conditions of the homes, so for example, the presence of mold, poor ventilation, these are just like the ones that we all think of in the retrofit space, but why they are there and the other factors impacting it. So I mentioned before, building management, concerns around overcrowding, the cost and decision-making powers around property maintenance, ability to speak up to your landlord, housing insecurity. So many of the processes and relationships that are embedded around retrofit or around housing will be able to come to light in this. So these factors, like I said, touch on social, political, and commercial determinants of health. And through doing this, we can bring all of the data into context, and it can speak directly to the structures at play in place with people, and not as an abstract, but as real lived and shared experience. And this is what's so often missing when we talk about data or research on health. So why is it relevant to retrofit? We've contextualized this tool that we've used in various contexts to retrofit, because retrofit provides a catalyst to gather around how we live. and the experience of our homes and neighborhoods and the way in which the lived experience of these places can shape and be shaped, and how these experiences run deep into impacting our bodies and their functioning. So if we think just on an immediate level, the environmental stresses in our environment, they could be thermal, they could be to do with light and noise, they could do with air pollution, water pollution. All of these things will be impacting our health in different ways. And since retrofit is not only a technical field, but also a relational and deeply embedded in the systems of governance and ways of living. So the CHIA has the opportunity to contribute to human health, both materially and structurally, as well as relationally. And embedding community health impact approaches from the start can lead to processes that remain intact for future impact measurement and evaluation. So Sarah was mentioning about this program being about measuring outcome, impact, and evaluation. And the benefits, one of the key benefits that we see of going through a CHIA process is that from the beginning, from the planning stages, if you involve communities and residents in the baselining of their health, then they're already attuned to pattern observation and they're already attuned to different kinds of like systems of understanding their experience. So this group is then way more invested and also practiced in evaluation and the measurement of outcome. So then to engage them further on to look at the effectiveness of a retrofit scheme, you would already have those relationships and those practices intact in practice. So that's what I say finally, that when patterns are collectively observed and noted, the relationality of what goes on in our homes and streets becomes much clearer. And all of this is to say that we'll just have a more accurate evidence base to be able to to implement these strategies much more effectively. I think that takes us to our next steps. Sarah, does it? We have some case studies
Yeah.
also. Um,
It does take us to next steps, but just as you were talking, what I'm doing here is just showing you my version of the workbook on screen. But we do have like case studies to sort of bring this to light because I think what we've been discussing is the fact that, you know, we've been in this space talking about this for a long time over the life of the project so far. And some of this might feel a bit abstract, but actually placing it in practice is really, really helpful. And there's a case study in here with the Portland Inn project, who are, you may have seen, we published last week our Retrofit Connect cohort profiles, and they're one of the community innovators that we're working with. And I don't know, Hannah, if you want to talk all about like, you know, what's fascinating is they came together and identified the point of interaction with their housing that was causing the problems, which on the first hand it was noise, but then we realized what that
mm,
was, what the structural determinants of that were.
Yeah, so
Um, mm,
um yeah, I could just quickly share their story. We first started working with Portland In Project, who are based in Stoke-on-Trent, in 2024. Early 2024, we had a community health impact assessment learning cohort, and we had about 12 groups across the country that engaged with us on doing that. And throughout this journey, Portland Inn were gathering with their community to understand what was impacting their health. And they initially gathered around noise pollution. They were wanting to understand how noise pollution was impacting their individual and collective health. And then through the process of gathering initially under noise pollution, they came to understand actually a biggest factor impacting their health as a community was bad landlords, and was actually the relationship that they had as perhaps insecure tenants in housing with landlords that had a lot of power to either evict them if they didn't want to do the works, but very like difficult relationship with their landlords.
mm,
And then they were able to access an opportunity to be able to demonstrate what being good landlords would look like through the potential stewarding of homes in their neighborhood. So to go on this journey, it means that when you're doing a community health impact assessment, you're gathering your community, you will have assumptions about what is impacting you, but it's only when you really sit down and work through it together would you surface the things that you didn't even know were impacting your health really all the way up. And the way
mm,
that they talked about it was if you ask people like, what is impacting your health. They're really likely to speak in terms that we've been told, like our lifestyle, are we exercising, or diets, like things that are very individual. But if you, in fact, ask what keeps you up at night, what causes you stress, and what environments do you feel most safe? And these questions actually bring forth such profound things around the things that are impacting us, the things that cause us great deals of stress, for example, insecure housing or poor housing. So
Mm.
this is why if you look through the case studies, and we have quite a few on our website, we can also share the links to those, and you'll see them in a learning journey that we have. You can
Mhm.
see the directions and the possibilities that doing this process can take you on.
Yeah. And I think that's really important about the judgments that are made, about the choices that people make when there's very little judgment made on the structural decisions that force a certain lived condition on people and communities. So it's really important that we start to like understand who is generating the data and collating the data by which we're using as a baseline to deliver retrofit programs around. And the simplest way, and Hannah started her part discussing this really, was that policy needs to be flat bottomed by its design so it can reach the broadest population possible. But then when it turns into practice, when policy lands in the ground, there needs to be better mechanisms to ensure that policy can meet the place where the place is at from the perspective of the place. Else, y'all are sending money back to the local authorities. So, like, it's really important for us to understand that need for that data. It is for the benefit of both parts of the system or all parts of the system that the two meet where they need to meet. So yeah, that's I think something we can get into in the conversation. Um, should we just, I think before we go into Q&A, if I come back out here, just so you can see, there was a couple of slides on the how, but you can go through that in the workbook yourselves. There's, step-by-step process of baselining and gathering the insights and moving forward into assessing an intervention. And like we talk about all of that. But then this is probably what's more important. If I go back to sharing full screen, I don't know if phones are going to love two QR codes on the same screen, but if you get to one of these, you'll navigate to the other one. I don't know, Hannah, if you want to talk a little bit about accessing the toolkits.
Yeah, so when you the links are also in the chat. So when you reach these landing pages, you'll see that there's a community health impact assessment toolkit and a community leaders toolkit. And all you have to do is input your name and the
Yeah.
organization or the capacity in which you're using it, and then you'll be able to download it. They're all free and open access.
Mhm.
And we only gather that information so that we know who is
Mhm.
using this. That's important for us to have that
Yeah.
information. And it also means that we can start to build a relationship so that if you have any questions or you need help walking through it step by step, or if it's just too complex, then we're there and available to it.
Mhm.
So that's how you access the toolkits. And
And I
then,
just want to say that the Chia workbook in retrofit is about setting the context and then taking you through what these processes are with retrofit in mind. And then the printables, the actual workbook bits itself, and the specifics of the really um, more granular process are what these two codes are. So you read ours first, and then you determine which pathway you're going to go down, and then you can access the more granular detail of practical tools through Centric Labs website, just so that is clear. There is a relationship between what we have published today. It is different, but is directly related and connecting you to the more detailed work that Centric Lab have done on these both specific ways. But then there's also this opportunity. Hannah, back to you.
yeah, so you can visit this learning platform. This basically gathers a lot of our research archive over the last 10 years, effectively, on the understanding of place and health through a step-by-step learning journey. It's self-paced, it's free to access. You just visit this link, an introduction to ecological health, and then you'll see that module one covers what is ecological health, what is community health, how do we understand place in health, and how to use data for health justice. So that's looking at community, lived experience, lived expertise, and then there's some tips and pointers on how to organize around health in your community. Module two goes a bit more into depth. So if that interests you and that's enough, you just drop off there. If you're interested, you could go further into module two. Module two covers what are the determinants of health, how are the determinants of health at play, how do these determinants of health translate into health risks, and various short exercises you can understand the broader determinants of health in your everyday life and in your community's life and in the neighborhood as well. And then that might be enough for you, in which case you can drop off there. And if you're still raring to go, then you can go into module three, which goes through the step by step on how to conduct a community health impact assessment. So if you sign up here and get going on the learning journey, we'll be around if you have questions or need support on it. And then later in the year, we'll also be doing some drop-in sessions and one-to-ones on answering any questions that might be coming through.
So yeah, if you want to hone your
Yeah.
skills in understanding how to apply all of this, you've just been offered some supported learning and training. So I would definitely take the Centric Lab team up on that offer. Okay, we've got some time. We've got like 20 minutes, give or take, for some Q&A. So I'm going to stop sharing my screen, and then maybe Ben, if you want to spotlight myself and Hannah and Josh if he's there. Um, yeah. So I have one question while the audience are thinking, and then if you want to either raise your hand, and then we'll try and get around to questions, or if you don't want to speak, you can put your question in the chat and we'll try and get to that. But yeah, I don't know if you wanted to just talk a little bit, Josh and Hannah, about the ecological introduction to ecological health. And I think it's maybe just for our audience to explain again what we mean by like health being ecological.
I'll take that, Hannah, just to save your vocal cords. So yeah, hi everyone, and thanks for that invitation, Sarah. Um, health being ecological is defined by that our health is influenced by all the systems around us. It's not just our behaviors. We know, and science has known for a long time, that when you breathe in fine particulate matter, it causes a inflammatory response on your body. And your body has a regulatory system. It's commonly known as the stress response system, and it starts to engage. And what we find is that there are multiple stresses from the urban environment, the built environment, the natural environment, and the social environment, etc., that can cause that stress response to engage. So it's more than our personal behaviors, it's our interactions with these different systems. And we say it's ecological because there are systems interacting with different systems. And so that's that framing of understanding that there are multiple pathways to understanding determinants of health, but there are multiple pathways to building health. And I think we heavily want to encourage that a lot of this work is also about building futures. And so I think in, for example, the community health impact assessment work, where communities are able to come together, talk about the places and spaces around them, and imagine how things can be. I think that that is a fundamental part, that people don't just want to talk about the bad things, they also want to build the good things. And we learned with one group that were doing this that they just they put forward plans about how to reimagine vacant commercial units in their neighborhood and how retrofit can also support that. Um, that sense of world building is critical to then building those strong relationships between local authorities and the communities in those places. And that's how we have experienced over time the relationship and the trust that gets built, so that when things like a retrofit agenda may come down from a policy lens, those relationships for implementation are already in place. And that's where we feel there's a great relationship opportunity here between, in particular, sort of public health departments, who are the epidemiologists. They are public health experts in a way that they can craft together the documentation of like a full health impact assessment with that community level of knowledge. And so that's that long arc of what is ecological health, how does it fit into CHIA? And I think when it comes to the eco health course, I don't know what more to say other than it's just that space to start further learning. It's an
Yeah.
introduction. It's looking at certain topics, and it helps if you're coming at it from a retrofit lens, understand some of the things that you see in the press or in the news, in reports from people go, I didn't think that was quite right the first time I heard it. And
Yeah.
that's a lot of our work is to validate what are a lot of people's experiences and perceptions and lived experiences as well of certain topics by underpinning that through meticulous research and building that out with partners. So that's kind of the reasoning for the EcoHealth course, as it's an introduction, is to just, yeah, improve that first step learning. I hope that's
I
what you
think actually just what you said, that bit about you might have read something in the press and thought, hang on a minute, that's not quite right. I think the recent journalistic efforts of writer in the Telegraph who maybe was a landlord themselves and suggested that perhaps landlords aren't to blame for mold and condensation, and perhaps that's the residents' fault. And I couldn't help but think, oh my God, this is why we need this understanding more and more now. I see Tim Ashadi has his hand up if he wants to come in for a question. You're on mute though, Tim. If you can unmute. That would be good. There we go.
Hi, yeah, it was in the chat as well, just about what whether you've done eco retrofit, someone's done it on scale. So what size has it been done, or in terms of percentage in a neighbourhood, how what percentage of neighbourhood has it been done, and then also what investment vehicles have been used, or has there been any assessment of the effectiveness of investment vehicles, or different types of investment vehicles to combine, the different equity outcomes you're trying to achieve.
Just a couple of really light touch questions for us there then, Tim.
I might be able to kind of answer part of the last one.
Yeah, please do.
Um,
Unless, of course, your internet has frozen temporarily, Josh, which we were sort of prepared for happening. If Josh comes back in, he can just start talking over me. That's no problem. I think in the chat also, thanks to my co-director Rachel Owens, who also has her hand up for a question next, Rachel put some examples of case studies of some of those retrofit projects that you might be interested in to look at, Tim. And I
I
don't
think
know about the
what's
finance
interesting,
bit.
Hannah was
Oh,
saying
here comes
before, beyond
Josh.
the which are essential.
And he's gone. He'll be back. That's what happens when you live in the Welsh hills.
I'm
Maybe
back.
Rachel.
He's
Oh, it's like a voice from beyond. He's back and he's gone. Rachel Owens, do you want to unmute and ask or answer a question?
Yeah, I just thought it would be good to bring something in the chat to this conversation because it's something really tricky, and I know it's something that we've also been, I guess tackling internally, mentally with it as an organization and personally as well, which is we're in a climate crisis. We've got really high levels of fuel poverty. We've got rising energy bills, and there's a whole load of urgency around all of this work that we need to do. And when we have these discussions, often it can feel like we're adding in additional steps, additional complexity, additional cost, which sometimes feels a little bit at odds with that urgency. And I know that this is something that we are always thinking about. How do you scale? How do you do it quickly? How do you do it right? And I just wondered if any of you had reflections on why it is so important to ground our work and whether there are particular, I guess, tenures and places where this is most important and why this isn't getting in the way of the urgency, but it kind of contributes to being able to do things to meet that urgency.
I'm so glad that Hannah's on the call for this one. And I don't know, Hannah, if you remember something that you said to me and you've probably said to other people, which is exactly the response to this. Do you know what I'm talking about?
The slow. So true. Yeah, I don't know if that's, but I said to Sarah once, slow is smooth and smooth is fast.
I
I'm
said
not
that
sure.
very phrase to my husband 2 days ago. Is it like a military phrase, isn't it?
Apparently so.
But
But
I
if
think
we
it is
take it
really
out of the military
important.
context,
Yeah. Go on,
yeah.
Hannah.
And I think, I mean, Centric Lab, if you're familiar with our work, is not large scale mass rollout. But that's not the work that we do. Um, we're really interested in impact at depth. And I think for us, it's like these things don't necessarily slow things down. And I think it does a disservice to the very active, very knowledgeable, very organized community groups that are on the ground that are already thinking about how to improve their homes, and that actually retrofit is an opportunity to mutually accelerate each other's work. So I think sometimes it requires a bit of a reframe and to slow down and to get to know and to build relationships. And then actually through those relationships, these things can be done much more effectively. And then there's less margin for mistake. And then you actually save money in trying to then remedy all the mistakes and things that are done poorly. And also, especially when you're thinking about the opportunity to even begin a retrofit works is often like really hard to come by. It takes loads of planning. And if in that moment you do as much as possible and touch on as many things as possible, it means that you're not having to come back again and again and again.
Mm.
So I think there's something about really and this is what we bring, obviously, like you guys are bringing the scale stuff, but we're really trying to think about what is the most effective way of honoring people in place so that they don't have to be displaced, and what is most effective for their health. And those savings are across so many departments that it's hard to be like, oh, well, the NHS would be grateful for us having saved them money. But if we think outside of budgets, that this like well-being is so much more meaningful if we think about health beyond whether or not we can afford our energy bills and beyond whether or not we're warm at home, but to think of home as like we have it in the report as a sanctuary. And could we be building off that? And then the impacts of that on our economy and all these other things are much greater. So we're really big fans of like slowing down and building relationship. And then the speed is much greater. And also not to discount the very active work that's already been done that just needs a light shone on it rather than assuming it's all starting from scratch.
Yeah, I would agree. And I would also kind of respond with, but what other choice do we have to work the way we're developing and working? Because this was why we pointed out our state of the nation and why we took a three horizons model approach. There's so much in the current paradigm of retrofit delivery or the net zero transition that is damaging and is not working. And I made a glib statement about, local authorities having to send money back to the Treasury. They do, because there's a lot of misstep between what policy is forcing and what place is ready to receive. And if you don't understand that the work needs to happen between those two places, then we're going to continue that very at the very out of step, misstep sort of pathway to delivery. You can't scale off what we're doing now. If you could, we would be much, much further down the line of what we should be delivering. So I'd urge to look into that State of the Nation report where we had what we very affectionately termed our Death Star diagram, but it was a Death Star because it showed the vast number of what we potentially do need to retrofit and then how much was actually being retrofit as this tiny pinprick in effect on that. And if that's what we were looking at over the last 13 years, then it isn't a case of like, just, get on with it, go quicker. It's not working. And until we can make sure that there are more smooth transitions and relationships between the different component parts, maybe that each component part does appear to work on its own, but it won't scale without us all ensuring that those transitions are right. And also, I think scale needs to be challenged in and of itself. We're not talking about an industrialized process of cookie cutter retrofit in every location on in any individual house. We're talking about many, many small things happening in a connected infrastructural way together to reach those numbers, to reach those communities. And as Hannah said, to recognise and honour the deep work that's already happening in communities. Maybe it's not called retrofit in those communities, and maybe it's not called decarbonisation, but it is called resilience building. So I think those things are really, really important in understanding how we can have that like seismic change that we need to see. Josh, I don't know if we lost you because of your Welsh Hills location, and I don't know if you had something that you wanted to conclude or say, and then maybe we've got time for one more question as well. So yeah, anybody wants to raise their hand, or Rachel, I don't know if you can see the chat, if anybody's asked a question in the chat, or Ben. Yeah, sorry, Josh, over to you.
That's all right. I'll try and go quickly. Yeah, it's regarding Tim's point. I think when you look at things like the hacked social value calculator, there are multiple metrics through which a broad retrofit strategy can touch on. And so, for example, improving people's conditions of their mental health and levels of anxiety they experience through things like housing insecurity and other points that Hannah mentioned earlier, there is an option for understanding retrofit more broadly at these other touch points. And there are other social values to that. So when we think about the funding mechanisms, there are other interested parties and ways to think about retrofit, let alone within something like the hacked calculator, there are direct metrics as well. And it's looking at those other more quality of life metrics that I think is a potential when we start looking at health. This idea is it being a community health, thinking about the community as a whole and their experiences and understanding how retrofit taps in. So that was just another vehicle which I wanted to bring forward, that the ways in which we can start to think about the role of this work and how policy designers can start to incorporate this. And even private sector organizations, when they think about the work that they can do, how can they be bringing more value to the process of what they're doing by thinking more ecologically or just systemically about the work that they do.
I just want to,
Yeah,
I
please do.
can, sorry, Sarah, I can
No, no,
just
please do.
see lots of conversation in the chat and it's like distracting me and I can't like keep up with all of it. But I just want to, I just want to speak to maybe Mike's point about this being too little and too late and why for us it's so important to go direct to community who are already building solution and why providing tools like the community health impact assessment is equipping communities to just act on their own. And I think if we look at a national at scale thing, it's like, what is happening? It's all a mess. It's not enough. But then when we go down to the community level and just be supportive where we can see that there is so much action and so much potential and like so much healing that is happening. And then it's our job then to like zoom back out again and see if we can piece this together, which is why the Retrofit Connect cohort is so impactful because it's like seeing like, oh, what is being done? And then how can we see that at scale? I don't think that's answering your frustration or your questions, but I just wanted to speak to that.
No, I think that's important. And I think it is important to acknowledge we know from our position in the National Retrofit Hub and for all of you who have joined us on the call and through our different partnerships that, we're in a really privileged position to be able to see a system overview of what's happening in retrofit from the relationship with policymakers and the relationship we have with communities and the feedback loops that people play within all of that. And we need to see each other as an ecosystem of partners who have the ability to intervene in ways that hold that like ultimate goal in sight. So it's really important, I think, for us to work collaboratively together to work through those issues and to see what the positive outcomes will be. So it's important for us to like learn from the work that's happening and then share it and share those case studies. And I don't know whether Hannah and Josh, whether you want to drop a link to the case studies in the chat as well, because I know you've got loads of those, but basically everybody examining. Yeah, Matt's just dropped in the chat. We are a mycelial network, and that's no joke. There is like so many like interconnected networks of people working across the country, and we're doing what we can to showcase those as well and to build our own network. Hence the joy it has been to work with Centric Lab and the other partners in this project. So unless there are any last questions, actually, no, I'm tell you what I'm going to do. I'm going to ask Hannah and Josh if they have a concluding thought to leave us with, and then we can let these good folk get back on with their day. So no pressure. Who wants to go first?
I might borrow a phrase from the organization I think helped brought us together, which is the way that Civic Square framed reimagining retrofit, which was around what if our transition to a just and regenerative future was designed by the people who live in the places we're looking to impact. That message is fundamental to addressing all the statutory obligations about incorporating lived experience research, about incorporating communities in decision making. What we've looked to do here is provide a tool. And so I think all we're doing is building off the work that other people have come before us and are putting out there. And yeah, in a kind of political hope, we hope that this helps you kind of think about the approaches and yeah, be in touch with us. Like ask us questions. We're here to help the delivery of this work as well.
Mm.
So please do come say hello.
And we'll be sharing more as well about how this work is going to evolve and how we can also just share to build up everybody's literacy around this. So we won't just publish this and drop it and go. We'll be back to this. Hannah, did you want to have any final thought?
I've just dropped the case studies in the chat, and
That's
I
a
look
good
forward
enough.
to hearing from people.
But I do think I choose to hear the slow is smooth and smooth is fast with your voice, Hannah, because I think it is like something that is really, really important. And it is true because of the different relationships that we've made through the number of years that we've been working in this space with communities and beyond. Where there is trust, we will go. That's where your ride or dies are. And that's what we do need to like ensure that we're doing here. So it's all about building those trust networks and working together. So with that in mind, thank you very much, everybody, for coming along today. And we will be sharing more as we go. And just a deep and heartfelt thanks to Centric Lab for helping us get to where we've gotten to with this output, and all of our other project partners, Arup, Trustmark, and Impact and Urban Health, and all of you for coming today. So thank you very much.
Thank you, Sarah.
Thanks.
Yeah,
Bye.
thank you, Sarah, and everyone at the National Retrofit Hub. Thank you very much for
Pleasure,
helping
pleasure.
make this happen.
Thank you.